Because we're filming. I think because we're filming, they want me to make sure I stand on stage. I'll leave it. I'll leave it as Hi, everybody. Welcome. My name is Dan Porterfield. I'm the president and CEO of the Aspen Institute. And today is my thank you. Today is my first day of work. So pretty great way to spend my first day with Raj and with all of you. And I just finished filling out my paperwork. I'm paying taxes today. I know how to work my internet, and it's just so good to be here and to welcome all of you who are members of the philanthropy community for what should be a great discussion in our regular series. And so with no further ado, let me just thank you, Raj, for being here today, and thank you, Jane, for taking the lead.
Thank you,
Dan.
Dan.
Great discussion. Thank you, everybody.
So as you all know, Raj Shah has played a role in the public, private, and philanthropic sectors. In the public sector, he was, oh my gosh, in the Obama administration, he started out as Undersecretary of Agriculture and Chief Scientist there, but then went on to lead USAID, where he emphasized innovation and public-private partnership. And then in the charitable sector, he played multiple roles at the Gates Foundation. I remember him most for, you actually really helped develop the global development program there. But what many of us remember him for is the innovations of immunization bonds with Gavi and with the creation of AGRA, the Alliance for Green Revolution in Africa. And then finally, in the private sector, you started a private equity firm focused on some of these issues. So I'm going to start with something you're really well known for. When you were at USAID, it was striking how you were able to build bipartisan consensus around such issues as Feed the Future, Power Africa. You were known for working across the aisle. Are there similar opportunities today to be seized?
Thank you, Jane. I think there are, and I'll come to that. I just want to say thank you to you for hosting me here and hosting our Rockefeller team. Matt Herrick is with me. Matt, you can put your hand up so folks know who to say hi to. And we've always admired the work you've done to lead the philanthropic sector and bring different people together across the aisle and across the country and across the world. So thank you. And I also will say, Dan, it is a treat to be here on your first day. I asked Dan, I think I'm officially your first external meeting as the president of the Aspen Institute, so that's kind of a fun thing. And we're pretty excited, in part because your predecessor, Walter Isaacson, joined our board as a trustee at the Rockefeller Foundation, which he can now do, having, I think, yesterday or something was his last day here. So we're excited to be at Aspen and be with so many friends and colleagues. On the bipartisan issue, I'm always hopeful that we can do good bipartisan work. Mike Froman is here, who's now with MasterCard, needs no introduction, but he, myself, President Obama, so many others always felt that our work that was international on global development issues, on humanitarian issues, whether it was raising resources to really address core humanitarian crises from Yemen to Somalia to Haiti, or whether it was kind of using meetings like the L'Aquila G20 in 2009 to address the global financial crisis on one hand, but then also launch major efforts to promote food security and fight hunger through investments in science and agriculture around the world, that those should be bipartisan issues. Those are issues driven by our core national interests. They are driven by a foreign policy that appreciates the role of partnership around the world and lifting up more vulnerable populations as part of keeping us safe and building our economic future. And so we all together approached it in a way that was about building a bipartisan coalition to help advance America's foreign policy, in part through our core values of service to others, particularly the most vulnerable. And I'm excited, not just because I think we were successful in some regards. We passed legislation on Power Africa, on the Global Food Security Act, elevated the role of global development and expanded budgets and staffing and all that. But perhaps even more telling is even in this new administration, in the Trump administration, despite the fact there have been administration budget proposals to Congress that would have really dramatically cut back on America's leadership in the world in these types of areas, a bipartisan group of members of the House and Senate, in this case led by Republican members, have not just pushed back, but have continued to increase investment in these types of results-oriented efforts that really are designed to bring people together as opposed to tear people apart. And so, yes, I'm a big believer, as I know you are, and many of you in the room are, and hopefully will continue to be in those types of bipartisan success stories. Today, at the Rockefeller Foundation, we're refocusing some of our energies and efforts on domestic economic opportunity, particularly for communities that have seen the steepest decline in economic mobility, access to education, per capita income growth over the course of the last 40 years. And in fact, the tax bill that was passed in December has had an amendment to it referred to as the American opportunity, around something called opportunity zones, where governors have been able to designate lower income counties in their states as opportunity zones. And investment in those zones benefits from really tremendous tax incentives for those making those investments. We can talk about that later because there's more to discuss about whether that'll work or not. But I think that is another powerful example. In that case, it was Cory Booker and Tim Scott working together in the Senate side, and John Delaney and others in the House side. And they made something happen in a bipartisan basis, even during what was a pretty, and continues to be a pretty partisan time.
And in fact, that addition to the bill was at the very last minute, if I remember. So it's been interesting to take a look. So even though in your role you're focused quite heavily on advancing knowledge, investment in science and technology, on expanding the bipartisan space. But when is it appropriate? When do you feel you need to take a stand? When there's disagreement, just go ahead and take a stand. What are the issues that call for that?
Well, so we have traditionally over the course, one of the things that's been fun about joining the Rockefeller Foundation is just learning its history. And over 105 years, there have been plenty of opportunities to take a stand. And they range from establishing the Social Security Commission in the 1920s and 30s before Congress passed legislation to make Social Security real. They include moments during World War II and just after, when they created a refugee scholar program to take scientists and academic scholars from Europe that were under either physical threat or ethnic threat or political risk and move them into American institutions. Madeleine Albright's father was one of them, as you and I both know, and I'm so proud to be associated with that act of clarity and foresight. So there have been times when it's been very important to take a stand. After the race riots in the late 60s and early 70s, they created a program that's now called Living Cities that really was about making a decades-long effort to bring cities together and support urban planning that addressed segregation and conflict and violence and racial tension in cities around America. So those, in my mind, are all stands that the foundation took with others to express its values. Today, we try to do the same thing. I mean, we are working with governors, county officials, private equity investment firms, and other impact investors and foundations to build a coalition of people that will try to use this opportunity zone tax legislation to make sure that really lower income people and communities and families have the opportunity to benefit from the tax law. And as billions of dollars of investment pour into the designated zones, all of which are within the lower 25th percentile of per capita income in our country, that they lead to opportunities for work and training and skill development and upward mobility for people that are there, as opposed to just increasing asset prices and leading to gentrification or moving people out of those particular communities. To me, that's taking a stand, because it's an expression of our values that we exist as a foundation to help those who otherwise are left behind.
In fact, you noted, we were in a phone conversation the other day, and you were saying that every American deserves to feel that when they're in real need or in a crisis, that we and our country stands by them. And I asked you then, what does that mean for Puerto Rico in this moment? And you had something to say.
Well, the foundation has had an interesting role in two major American crises, one around Katrina and one around Superstorm Sandy. And in both cases, our work on helping cities and communities plan for the future, and in particular plan to rebuild more resilient infrastructure, especially to storms and climate events, helped us play a role, a modest role but an important one, in ensuring that the tens of billions of dollars of public sector investment and the rekindling of private investment helped to build those communities back better. And Walter Isaacson, I know, was a major partner for the foundation long before I got there on the Katrina, on the rebuilding of New Orleans after Katrina. And you can walk down Central City in New Orleans and see communities that have been totally revitalized because community development block grants were used in a particular way in partnership with local businesses to enhance local educational opportunities and to just rebuild core infrastructure in the city of New Orleans. Similarly, for Superstorm Sandy, they were able to leverage billions of dollars of public investment through competitions like Rebuild by Design that helped communities optimize their planning and their infrastructure design for the reconstruction. So when the hurricane hit Puerto Rico and we saw the crisis there, we very much wanted to play a similar role. We have a program called 100 Resilient Cities, and San Juan, Puerto Rico was in the program already, so we had a small team working with the mayor in San Juan, and that allowed us to build a multi-stakeholder group and put a plan together for how to best rebuild and reconstruct Puerto Rico so there's real opportunity. That plan will come out in about 6 weeks, and we're very hopeful that it will help guide. I think there's 16-something billion dollars of community development block grants that will go from HUD into Puerto Rican communities. There's another potentially $40 billion or so dollars at FEMA that can be expended over years to help reconstruct certain parts of the Puerto Rican economy and those institutions. There are private investors and private firms lined up both to do philanthropic work, but also to kind of seeking partners so that they can make commercially oriented investments that would improve the core energy access or reconstruct the medical system in Puerto Rico. But I would argue that this is an opportunity for all of us to come together in partnership and do some extraordinary things together. And I'd also say that it is an opportunity to take a stand. I had the chance with Mike to be a part of leading the Haiti reconstruction effort and the American response to the crisis in Haiti after the earthquake. And to be honest, I never felt that an American territory with FEMA's jurisdiction and resources could, have such negative outcomes for a storm. Despite what the official statistics might say, easily a third of the island doesn't have any reliable access to power even today. And the statistics, of course, don't admit that. But I've walked through Playita outside of San Juan and other communities on the island, and it is really, really bad. The death toll numbers are extraordinary. People died in Puerto Rican hospitals weeks, months after the crisis because there was no power in the hospitals. folks, that takes a generator and some gasoline, and you have that problem solved temporarily, and there's really no reason for that. People weren't able to get food in a American territory months after a crisis. It has been a really challenging situation, and there are lots of reasons for that, and we don't have to get into it. But certainly, we can come together and take advantage of the new resources that will go onto the island. Take advantage of the fact that we're only talking about 2 million people, 2.5 million people. Try to stem the tide of people leaving permanently the economy there, and try to do it with private sector partners that might be willing to hold hands and make long-term investments. I'll add one thought, which is, as of a couple of weeks ago, all of Puerto Rico has been designated an opportunity zone per the new tax legislation. So that means anybody with any kind of unrealized capital gain can make an investment in Puerto Rico and defer your capital gains tax completely for at least a decade. Then when you pay it, you pay a reduced nominal amount. And then any money you make during the 10-year period of the investment that you hold is completely tax-free. So for tax planning reasons alone, we should be able to identify investors that see opportunity in bringing wind power, solar power, residential solar, health services, community education services to Puerto Rico and rebuilding an economy there. And we see a lot of opportunity right now, and we're reaching out to people to try to find partners to do that with us.
Mm-hmm. Now, this is a story of you leveraging private sector dollars, leveraging public sector dollars as you move forward, but you're also known for leveraging technology, right? And so I wanted to have a sense from you in the areas that have been most, you've played such an active role, global health, for example. Where are the opportunities there to leverage technology going forward? And what is the obligation of the rest of us to establish the norms for the ethical use of various technologies? I think about gene editing, for example, and all the benefits that could come from that, but poses ethical problems.
Yeah.
Questions, I should say.
It's a great question, especially because looking forward in health, we also see that the very development of the technology creates questions around data privacy and ethics that need to be addressed and are being addressed very differently in different parts of the world. Just to rewind a little bit, one of the things I learned when I joined the Rockefeller Foundation was how much of the original commitments that John D. Rockefeller made in 1914 were inspired by the idea that health itself was transitioning from a sort of commercial snake oil sales type of industry to a science-based industry. And they were committed to that science basis, so they invested in and created institutions like Johns Hopkins Medical School and School of Public Health. Actually, most of the medical schools on the East Coast exist in part because of those early investments. They felt they should eradicate diseases like hookworm in the American South and built large-scale eradication programs that then grew into first for hookworm, then for malaria, then led to a donation to the federal government, which created the Centers for Disease Control based out of Atlanta. They hosted, this was so brilliant, but when the League of Nations was created, they wanted to make sure that the League had a science-based health advisory group to think about international health. And the League of Nations itself apparently was less interested in that topic. So they said, okay, no problem, we will host an international health committee for the League of Nations and bring to it all these science-based medical experts. And that then they spun out as the World Health Organization, and it became the World Health Organization. So the thing that I've been amazed by is this faith in science and this commitment to building institutions that can stand the test of time. When we look at the challenges today, we see the same opportunities that maybe they saw way back then. Today, those of us working in global health have tried to address the fact that 6 or 7 million children under the age of 5 still die every year of pretty simple diseases: malaria, diarrhea, pneumonia, birth asphyxia, not being able to breathe when you're born in the first 48 hours of life. And we can address that. We've set a global goal of getting that effectively down to a few 100,000 deaths so saving 6 million child lives a year by just 2030. The reality is most of those deaths happen in difficult-to-reach communities, like poor urban slums in emerging markets or lower-income countries, or deep in rural communities where people don't have access to care. And today we see so many information technology-based models to provide care into those difficult-to-reach communities. I was just in China where they have artificial intelligence algorithms that effectively provide primary care to 100 million plus people that live in Western China based on just a few medical doctors leveraging their outreach. So instead of seeing 50 or 60 patients in real life, they have an app and technology-based interaction with hundreds of thousands of patients, and the algorithms are able to do some of the real diagnostic and counseling work that otherwise medical professionals would do. It's not to suggest that AI is the answer to everything, but if we could redirect, the world spends about $35 billion on global health assistance every year in lower income countries. Our estimate is if we could redirect about $2 billion of that to pay for community health workers that are lower skilled workers, but are out in village communities or in urban slums, going door to door, and then empower those workers, usually with Android-based devices and other tools that help them do their job more effectively, because they can, through predictive analytics, know which particular household is going to have children who are more vulnerable than another one, all of which is now doable, that we can be a big part of helping to achieve that goal of saving those 6 million child lives. And we just announced a couple weeks ago, Naveen Rao, who led Merck for Mothers and served on the executive committee at Merck, has joined the Rockefeller Foundation to lead our next era of work in global health.
And what about hunger? I mean, there's also a place, back to gene editing, but other technologies that are helping to make smallholder farmers much more productive. How do you think about the use of technologies to address the issue of hunger?
Hunger is similarly positioned in the sense that there's been, and I was proud to be a small part of this during the Obama administration, but there has been a movement really since about 2005, 2006 to accelerate investments in agriculture and bring more science to food systems, especially in lower income countries. And it is still true that we work actively in 11 countries in Africa through a program called the Alliance for a Green Revolution in Africa. In those 11 countries, more than 50% of total employment and more than 30% of total GDP is still coming from the agriculture sector, which is really, that's a pretty outdated characterization of an economy compared to a more industrial or more diversified economy. So in those types of countries, significantly improving agricultural productivity makes a big difference in both the incomes of farmers, the access to food and nutrition for populations, and the ability to diversify the economy and really move ahead. So our AGRA program has helped those 11 countries significantly increase their crop yields over the last decade, and it's done that by working on getting better seeds, better fertilizers, better water management practices, to even very smallholder farmers. I think the next frontier for food and hunger is really going to be very exciting and grounded very much in science. We're just starting to learn, believe it or not, about the significance of certain types of protein and fatty acid combinations in really vulnerable children for fighting stunting and helping them be better nourished. These are some new studies that are just from Guatemala and elsewhere over the last 2 years that are showing this. And so we're very committed to taking that science and trying to change the way, for example, the World Food Programs runs school feeding programs, which reach hundreds of millions of children. And if we could just get more protein and more animal-like protein products in those feeding systems, we could make a big, big difference in the health and welfare of otherwise very poor kids.
So I want to take you to the practice of philanthropy. And again, the theme throughout is going to be leverage, I think, because you've been so brilliant at that leverage and innovation. you started something, or you're incubating at Rockefeller Foundation, something called Co-Impact. What is that?
So Co-Impact is a collective effort we started last year. It's a collaboration between, as of now, 5 or 6 members of the Giving Pledge community that have come together and said, look, we've been very fortunate, very successful, and we've committed to give more than half of our wealth away. The Giving Pledge, for those of you that aren't aware, was started by Bill Gates and Melinda Gates and Warren Buffett probably a decade ago. And today, hundreds of families around the world have signed on to it, basically to say they'll be part of this big renewed movement in global philanthropy. And to be honest, finding opportunities to use those resources effectively and really achieve success at saving lives, fighting hunger, alleviating poverty, and reaching the most difficult to reach communities in the most difficult parts of the world is a challenging task for anybody, no matter how many resources you have and wherever you may be based. So we built this platform called Co-Impact, and we accept funding from Giving Pledge families and others who would like to be part of a collaborative effort to address hunger, poverty, malnutrition around the world. And then this year will be our first year in action. We'll be announcing a package of grants and partnerships that will help to significantly deliver those types of outcomes in community health, outcomes related to food and agriculture, outcomes related to education for very poor children, improving educational attainment, in particular literacy and numeracy outcomes for millions of kids in different countries in Africa. And I'd just say the one thing I've learned is this is hard work to do alone, right? You really always need partners to be successful. Sometimes those partners are other philanthropists, sometimes those partners are country governments, sometimes those partners are science and policy experts like some in the room today, and sometimes those partners are major financial institutions that issued the debt for the immunization bonds that you made reference to. And professional philanthropy is a serious task that takes time, effort, investment. And so if we can help serve that role and do that with our core partners, which is what we call our other partners in Co-Impact, we think we can accelerate the movement towards a world where there's obviously significantly more wealth. There ought to be significantly more active philanthropy delivering results.
Yeah. And so many new philanthropists don't want to make the investment in staff. So the Rockefeller Foundation has got teams that can evaluate various grantees, set a strategy, et cetera. And that's, if you don't hire staff, it's good to leverage yours. Let me ask you a question from the grantee perspective. You're in a unique position in that you know what earmarks feel like, having run USAID, and so you know what project funding is like, and wondering where you get your true costs covered. Is this something that you think about and your colleagues think about leading other foundations as they go more and more for project-based, so many of them do, particularly new philanthropists, for project-based grants? How do you cover the true costs? How do you avoid diverting needed resources from core mission activities? Is this something that you worry about?
Yeah, we think about this a lot, and I think I give a lot of credit to a group. The Edna McConnell Clark Foundation started something called Blue Meridian, which really was a domestic model for bringing new philanthropists together and doing things at greater scale in a collaborative way. And frankly, we learned a lot from them as we set up Co-Impact, which is the Blue Meridian for international work, right? And in both settings, the goal is to say, how do we help partners achieve genuine scale? And often that means making larger, longer financial commitments. It usually means shaping projects, but making sure there's real resources for building staff, building capacity, building partnerships. It often requires getting governments to play ball along with those partners so that we're not just in it alone as philanthropists. And it requires picking winners so that you're taking the long view and saying, we want to build this institution into a successful institution for the long run. Blue Meridian has done that, just to give you one example, with a group called Upstream, which provides voluntary family planning access in American cities across the country. And they have phenomenally effective data to show how important that is at helping women with their economic mobility and educational outcomes throughout our own country. And by bringing together philanthropists and saying, okay, instead of doing 20 different small projects with Upstream, let's all just say, we want you to be a successful transformational institution, and we'll stand behind you in a collective way. I think they set the model for how we might work. And when we make our grant announcements later this year through Co-Impact, I think you'll see that they will have learned the spirit of that shared commitment and hopefully embody some of those same principles.
Now, while folks think about, we're soon going to turn to the audience for questions, and there are folks with mics all around, so ready your questions. And while you're doing that, Raj, I wanted to go back to where you started and your reference to new directions domestically. You've devoted your career to trying to lift millions from poverty around the world. But here we are faced with a large, a significant part of our population experiencing a declining standard of living. How has that, sort of in practical ways, I understand this is a problem you want to address. What does that mean? Does it mean funding for education, for job readiness? What does that translate into? What strategy can you imagine?
Well, first I'd say the analysis that we found very compelling was just when you looked at economic mobility over time. I think it's without question at this point you can suggest that in America economic mobility has become much more narrow and much more constrained. So if you were born in the 60s or 70s, there was a 90+% chance you would do better than your parents economically. Ironically, the ones who didn't fit that category were the ones whose last name were Rockefeller, usually, for obvious reasons. But everybody else could be expected to do better than their parents. That today is now less than 50%. And that's just, and when you map, the other statistic there is if you were born a child in poverty in America in the 50s and 60s, there was a 50% chance you would end up in the middle class.
Yeah.
And today it's less than 30%. And when you take those statistics and you map, and we can do this now because Raj Shetty at Stanford and his collaborators across the country have had access to both tax record data and census data, so they were able to integrate it and map it and be geo-specific and looking at where has opportunity dried up the most. And it maps to what you would expect. It maps to the communities where incomes haven't moved on a per capita basis in a long time, where there's a high rate of opioid use and crisis, where mortality has been declining in both African American and Caucasian male communities over a period of time. So it is more place-based than might be immediately apparent in terms of where opportunities dried up. So there are a group of foundations that we're a part of. The Markle Foundation is kind of leading this effort, I think, that has really done a lot of work on the skills side and is looking at what are different models to help people gain the skills they need to be more upwardly mobile in a future economy. And the big learning there is that the things they're most excited about and have the most data to be enthusiastic about don't always map to our four-year college system or our high school graduation certification systems. And I do think we need to learn from other countries and other systems where, if you want to be an electrician, you can get that training and go do that. And that can be rewarded in our economy as an important skill set that is necessary and provides real upward mobility, which is true in Switzerland or Germany, but not in the United States. And as a result, like we were walking the River Rouge plant in Detroit, and where they make the Ford F-150, you can sit and talk to folks. They're waiting 7, 9, 12 years in line to get trained as an electrician so they can get that next step up in their, in their pay and in their status and in what they're able to contribute on the assembly line there. And why do you have to wait 9 years to get trained as an electrician? We should have a better skills-based system to do that. For our part, we've been more focused more recently on the Opportunity Zones legislation. and the idea that this seems like the largest tax incentive in 100 years to put real capital, real private capital to work in low-income communities around this country. And governors responded very fast. So the bill passed the end of December. By April 22nd, every state and every territory except Guam had submitted its applications for identified opportunity zones. I think all but 4 or 5 are currently approved. And we're already starting to see very significant funds form because we know the capital will come because the tax incentive is just so powerful. And the question is, what have we learned from prior empowerment zone examples, the Community Reinvestment Act, other incentives that have put capital into lower income communities that sometimes have helped to lift up those communities and sometimes have not. Our view is we need to help make sure that this legislation, which will deliver billions of dollars of investment in low-income communities throughout America, works to lift people up, not push them out. And that's the kind of role a foundation working with lots of partners in the public and private space can play if we are thoughtful about it.
So a not unrelated problem is political polarization in our country, or polarization more broadly, culturally, economically, as you've noted. What role can philanthropy play? And when I say that, I mean philanthropy and civil society more broadly. What role can it play in kind of building the social capital and the trust that knit us together? And is this something that's on your mind?
Well, it's on our mind, but I'd also say we are very kind of practical and pragmatic. And maybe to me, that's part of the answer. Like if we can bring people together and in a very pragmatic way, ensure that hundreds of millions of dollars invested in Newark's Opportunity Zone helps to move people out of poverty and helps create jobs and helps connect those individuals to skills training so they can get better jobs, that practical example hopefully inspires others to believe we can solve our own problems and therefore brings us together. Our work in Puerto Rico around this commission we established to define what a more resilient, more successful Puerto Rico could look like has 25 commissioners, has had hundreds of stakeholder meetings, is really trying to be inclusive about getting everyone from across the political spectrum, across rural and urban divides, across income divides to come together and say, how do we want to use this crisis as an opportunity to change the future of Puerto Rico? And our sense is if we can nurture along those types of just practical examples that bring people together, that hopefully others will look back and say, okay, we can do this too.
Yeah, no, solve real world problems and you build social capital in the process. Alan's got the first question, if you bring over a mic to him.
Thank you. Alan Sessoms, and thank you very much for the presentation. Two questions. In Puerto Rico, how do you, when you help rebuild the infrastructure, assure that the so-called intelligentsia stay? Because we were recruiting students to help the University of Puerto Rico, and they said, stop doing it. You're killing us, because they're not going to come back. Secondly, in your agri program, when you make your agricultural sector more efficient, how do you retrain the people you displace?
Well, those are both great questions. On Puerto Rico, I would just say, I think, and I think our team thinks that this next 6 to 12 month period is pretty critical. There's very specifically identified public and private resources that can go into Puerto Rico. And how those resources flow, which partners have access to that capital, and what they do with it will be very defining as to whether we can stem the tide. I guess 500,000 people have already left Puerto Rico, with more than 300,000 of them potentially in Florida alone. So how we stem that tide and create opportunity that wants to keep people there, especially young people, so they see that there's a future for themselves economically, that's a critical part of what success looks like. But just again, to give you a practical example, all those people died because hospitals and then community centers basically didn't have power months after the disaster. There's no reason why they shouldn't all have backup, renewable, distributed power systems, rooftop solar with a small battery. And as we all know, residential solar is expanding rapidly in the United States. It gets a big benefit because there's a tax credit that helps that helps companies afford that and helps make it affordable, that covers more than a third the cost of the whole system. In Puerto Rico, companies can't take advantage of the tax credit because banks that monetize it in the 48 states look to Puerto Rico and say, well, there's some succession risk and it's just a different market, so we're not going to monetize it in the same way. And that has basically held up residential and individual building-based solar and distributed renewable energy platforms. If we just solve that and we just make sure that every school, every hospital, every community center across the island has its own backup renewable power system, that island will be so much more resilient the next time there's a storm or a crisis. And those are, if we do 10 or 12 of those types of projects at real scale, hopefully we've created an environment where people want to be there and see the opportunity for themselves personally.
I'm going to turn to Maya Ashmara, and then we're going to be over here, and then we'll come over to this side of the room.
Hi, I'm Maya. I want to go back to your core philosophy about science, right? And science being the history of Rockefeller Foundation. Science is under attack in this country, in the public discourse. How is Rockefeller Foundation addressing that? Just curious.
I'm so glad you asked that because one of my first set of the kind of special grants we did were all around that specific issue, just helping to advance the AAAS and their capacity to be advocates for science-based policymaking, helping to enhance the role of scientific reporting by journalists across the country, and supporting some of the science associations, including a group that I forget exactly what it's called, but it's the science funders that are philanthropies that believe in science. The Science Philanthropy Alliance, I'm sorry, which is right down the street, and we've rejoined that. So we've done 6 or 7 of those types of grants and partnerships to sort of re-enter that space more aggressively and to recognize that right now is a particular moment in time when advocacy for science-based thinking is quite critical. And there are some key institutions and associations that have traditionally played that role. We've tried to stand behind them.
Right here. And then we'll come over to this side of the room.
Yeah. Thank you. My name is Fariba Parsa. I'm founder and president of Women's E-Learning and Leadership at George Mason University. My question is, or maybe you could talk about your vision and thoughts about women's empowerment and leadership. We cannot do any development project without women. Thank you.
And let's come over here. Here you are in the front row, and then we're going to go back. Let's start here.
Shah, my name is Oda Aberdeen. Can you tell us what do you do, for example, in a place like Yemen, where you have poverty and you have disease, and in Ethiopia? Can you give us concrete examples?
Sure. Let me speak to that first, and then the question around women. So the Rockefeller Foundation is not currently active in Yemen. I had a chance when I was at USAID to both visit and to support humanitarian and other programs in Yemen. I think Yemen is, especially if Cape Town manages to manage their water resources, Yemen will be the first country to run out of water. There's obviously a tremendous security conflict taking place that has displaced ever larger percentage of the population. The ongoing humanitarian burden in both the North and the South has continued and accelerated since I started to get involved in that in 2010, and has just been, frankly, a deteriorating situation because of the armed conflict and then the closing off of the Saudi border and other types of challenges. So in my view, on something like Yemen, a foundation will try to do what we can, but the reality is, we need real political leadership to address the true problem, which is a war that is taking place. And we need much more resources and support for the humanitarian agencies that have had the courage and the support to kind of work in that environment and provide solutions. The most inspiring thing I saw in Yemen, though, was there was a time, I guess this was 2010 or 2011, when they were going through a process to develop a new national constitution. And they were very committed, to your question, to ensure that women's voices and women's rights were embedded in that new constitution. And I remember being able to visit and sitting with a group called NDI, the National Democratic Institute, partner of ours that had pulled together this and was supporting this constitutional development process. And it was all led by women. And in Yemen at that time, that sent such a powerful message. And they were young women, they all had college educations, and they just saw this as their ability to build a better future for themselves and for their community. And everyone there knew, like you didn't have to say it in development speak language. Everyone there knew that if women were leading this effort, it was more real, more serious, and more hopeful because women's leadership, particularly in a place like Yemen, is critical to the success of the country. But frankly, all of that work was undermined by conflict and war and humanitarian crisis. So I'm sorry I don't have a more optimistic example in Yemen. Ethiopia is the counterpoint. Despite some significant repressive and authoritarian tendencies in their government, they have been growing at 8% a year regularly for the last decade. They've made significant reductions in child and maternal mortality, in poverty, and in hunger. Programs that we all set up a decade ago, I forget, the acronym was GSRP or something, I don't remember what that stands for anymore, but it was a public feeding program that reached almost 20 million people and targeted vulnerable populations in particular, because every 3-4 years there's a drought and agricultural output is threatened. And so when we launched that program 10 years later, people look back and believe that program has helped millions of people avoid the natural downturn of a bad agricultural year by providing that sort of feeding, public feeding support so that they're better nourished and they're able to see through crises. And today, one ought to be, I think, pretty optimistic about the economic and development pathway in Ethiopia, which is probably amongst the strongest in Africa and has remained the strongest, as we've seen foreign investment pour in largely from China for manufacturing, taking advantage of AGOA, by the way. And Mike can talk to that. But it has created tens of thousands of jobs, and they're trying to create millions of jobs through the smart use of their participation in the African Growth and Opportunity Act, coupled with investments in power and infrastructure and light manufacturing. So I just think two totally different examples. Sorry to go on, but on your point about women, I think we take very seriously, because our institution's been around for such a long time, that that our work is almost always primarily through women. Our community health effort, for example, which will be a defining effort for the future, almost all community health workers are women. When we think of developing and designing better data analytic tools to help them be more effective in their work, it's all with the understanding that in that case, the customer is the woman. Similarly, for our Agra project in Africa, almost all of the meaningful farm labor on these particular smallholder farms are provided by women. Thankfully, we have an outstanding CEO, Agnes Kalibata, who runs that project and was the former agricultural minister in Rwanda, and is exceptionally focused on making sure her teams in 11 countries know that their job is to serve women farmers and those working in that context, because we know that makes the biggest difference. So it's a constant challenge, a constant opportunity, and it's good for you to raise that question and to do the work you do.
So, yes, go ahead, right in the middle there, and then we'll go back to Randall.
Hi, this is Karen Ziffer from RARE. There seems to be an unraveling consensus, both in this country and internationally, on the role of managing natural resources and its connection to health, poverty alleviation, and many of the goals that you talk about. Do you see any role for the Rockefeller Foundation in helping to rebuild that consensus?
Around natural resources and its relationship to health in particular?
Natural resource management and the environment.
Yeah.
As a basis for
Yeah.
health and poverty alleviation.
Yeah, I think there is, and I think we try to. So we've had, in our health work, for example, we've invested in an effort we call planetary health, and I don't know if you look up the Planetary Health Commission, which published their findings in The Lancet recently, they show how changes in natural resources and, frankly, environmental degradation both affects disease prevalence and core health in many, many communities. And it ranges from the kind of global modeling of where the next pandemics will come from to the really practical reality that, all the children in New Delhi have asthma, and we have to see environmental consequences as really, really tied to health. Our Resilient Cities effort is really all about helping cities build infrastructure that is resilient to future climate threats that address a different end of that spectrum. But I think it's an important observation, and we do try to take it into account where we can. But the Planetary Health Commission is excellent. I think Larry Summers chaired it with Richard Horton, and their findings are in The Lancet, and I'd really recommend that.
So we're going to take two questions in a row and let you then answer both, starting with Randall, and then we're going to come over here to the front row.
Hi, Raj. Thanks again for joining us at the Institute. Randall Kempner with the Aspen Network of Development Entrepreneurs. Want to ask you the broad question of how, if at all, have the Sustainable Development Goals mattered to the foundation, and has you actually started organizing around them, or are they just sort of out there? And maybe guessing a little bit at part of your answer, would love to hear what parts of the innovative finance portfolio that you have that are exciting you right now.
Great. Well, thank you, Randall. The first question is hopefully pretty straightforward to answer. We reorganized ourselves around 4 major areas of work: health, food, power, and jobs. And all of them we've set goals and targets that align with the SDGs as they've been defined. Health is probably the most obvious because there's such a specific quantitative set of goals around maternal and child health reduction. And we're going to focus on achieving those goals in 22 high-burden countries around the world. But like that, in power access and other areas, we're trying to align our work to those goals. And part of why we do that is everybody else does that. So it's easier for us to partner with Unilever on big sanitation projects around the world if both teams believe that their kind of quantitative goals over a decade tie to the same basic objectives. And so I find the SDGs to be, whatever you think of how much whether they work or they don't work, I think they work. They work particularly well in allowing us to build partnerships if those partners all align their goals against those SDGs. On your question about the innovative finance portfolio, just so folks who don't know, we've been fortunate at the Rockefeller Foundation over many years to have a portfolio of work we call the Innovative Finance Portfolio. And the group is led by a brilliant woman named Sadia Mossberg. And she and her team have developed financing mechanisms that allow us to attract private capital to the tasks and the objectives we set forth. So sometimes that takes the form of designing social impact bonds for everything from prison recidivism in the UK to immunizations, as you point out. We have insurance products that are designed to improve or support the reconstruction and protection of the coral reef in the Gulf of Mexico. Ultimately, we will put resources, and we have a group of financial sector partners that come together to design these instruments. But it's ultimately private sector partners, in that case, hotels all around Cancun and Tulum, that buy the insurance product, and then that provides the capital to do the reconstruction and protection work in the reef, for the coral reef. So we are pretty excited about that portfolio of work. If anyone has ideas and would like to partner with us or have recommendations, we'd love to take that on, and we see opportunities all the time to do that. Like I've mentioned, the tax credit in Puerto Rico not being available, but available everywhere else. We think it's probably possible for somebody, maybe the Rockefeller Foundation, to insure some bank against the risk that Puerto Rico is going to secede at the time that they have to cover that. It seems like it would be a low-cost thing, but our team is working on that. Because if we can then you basically have private banks just working commercially to monetize that tax credit for companies like Sunrun and others that can go ahead and reduce the cost that they have to charge customers by 30 or 40%, which we think would dramatically change residential solar access. So we just see those innovative financial tools as important tools to achieving the goals we've laid out. And we're very eager to work with everyone here who can contribute to that, because we're never going to get there with just philanthropic capital. We need to be more creative.
I'm going to bring a microphone there. And is there anybody in the back in the center? Okay, and then the last question is going to go right to the dead middle of the center.
Thank you. Andrew Simmons with the UK NGO Resilience.io. I actually was going to ask about planetary health, but I don't have to anymore. Another question. So in the past, you've spoken about a fractured world a lot, and from Jane's question, we heard about how much aid and philanthropy historically have been delivered on a project-by-project basis. Is the foundation looking at supporting solutions to involve all stakeholders collaboratively, perhaps through open source and open access data platforms, for example, to improve the impact of every dollar, as you were just saying, through integrated approaches? So sort of data platforms of sort of leveraging what people at the World Bank have called the missing middle of development actors, of bringing everyone together through sort of integrated systems approaches.
Who knew you were going to have a data nerd up here who can answer that question really well?
Well, I don't
So
know
go
that I
ahead.
can, actually. That's a pretty complicated one. We've built a great in-house data team, which is working with all of our grantee partners now to collect and integrate data and to create open data platforms so that we and others can perform analytics on the data that we collect. And we believe that's really important going forward. We've modeled it a little bit after, the project is led by someone named Steve Van Rokel, who was the former White House Chief Information Officer and led the open data project coming out of the last White House that was a government-wide effort to do similar things. I think there's tremendous promise. It's important, but it's also a first step. Like for us, like the real wins in data analytics applied to our work are when we can get access to massive amounts of data and information, and then work with partners that have all that information to do the kinds of analytics that help really practically solve specific problems. Like I keep coming back to this, but it should be possible to use, we can now use geospatial data alone to identify which farmers in a village in Kenya are more likely to be more productive if they get access to better seeds and fertilizers, and which ones aren't. And there's a group out of Stanford that can actually do that in an exceptionally valid way using only geospatial data. That information helps our AGRA program in Kenya target those households that are going to have the biggest bang for buck in terms of reaching them versus someone else. Those kinds of really practical insights driven by predictive analytics, I think, will transform our ability to be successful. The challenge for us, to be quite honest, is very few nonprofits today can afford data scientists and people who do this work. I look to you, Mike, because you have probably hundreds working for you, but we need to partner with companies that have that capability and that commitment to mission, and figure out ways to make sure that the whole nonprofit sector doesn't just miss the boat on a part of the economy that's just transforming everything.
Yeah. And the final question here.
Thank you for taking my question. I'm not exactly sure what my question is. In the sense of, I see the largest growing industry in this country being one that involves multicultural, multi-generation, but that actually comes from a capitalistic perspective at this point, which tends to be memory care and assisted living. And when you do on-the-floor observations at these facilities, you see that whereas their goal is taking care of the clients that are living at the facilities, what they don't do a very good job of is taking care of the staff. And to realize that the staff are usually minimum paid GNAs, CNAs, and I don't see, do you see anything in this country that's addressing this issue? Because this is a major growing issue in this country.
This relates back to work too. I mean, it's interesting that the care industry, the caring industry is underpaid, undercompensated in every respect. Would that be part of your thinking as you look at domestic issues related to jobs, et cetera, and equity?
Yeah, to be honest, that was a very specific example that I don't think we have a lot of insight on. Your broader point is something we do work on. We have partnerships with firms like Care.com, and we're expanding them with firms like Lyft and others to just to better understand in a gig economy with a lot of contract workers who don't have benefits, who don't have portability of benefits, who don't have I'm not a huge, it's not my belief that universal basic income is a solution out there that should be embraced by everyone, but there are people in this rapidly growing gig economy that effectively have 2, 3, 4 jobs and no benefits and no living wage. And if that's going to be such a rapidly growing part of our workforce, we don't even capture labor statistics in that community as effectively as we should. And I know Al Fitzpaine and others are doing a lot of work on this, but we need to sort this out and better understand it. So we've supported some efforts, including at Aspen, to study these types of issues and learn more about them, and hopefully we can be a part of the solution.
Unfortunately, I have to whisk you away to your next meeting, but I want to thank you so much for giving us this time, and thank you for such great questions.
Thank you. Thanks very much.